So good afternoon. Welcome to Partnerships for Coordinating School Healthcare, Lessons from Two Large Cities. Although I do like to call Baton Rouge a small country town. That's how I feel about it. I'm Sue Catchings from Baton Rouge, Louisiana. And my partner in crime here is Marilyn Crumpton from Cincinnati, Ohio. We run very similar programs in our two cities, and so we have linked up to think about how could we do a better job and how could we work together. I do want to tell you all that we are live streaming this session, and so if you have a question, we're going to ask that you go to the mic so that the people that are watching us live will be able to actually see you. So our objectives for this workshop are for you all to analyze ways to create collaborative and coordinated service delivery systems in your school health centers, prioritize a way to use state, local, and programmatic data, which I would tell you my personal belief is your programmatic data should drive what you do, to determine partnerships and collaboration, and then how do you apply the lessons that we have learned and do it better than we're doing it, because believe me, what we're doing is not rocket science, and you can do it too. I've been asked to tell everyone that neither of us have disclosures or conflicts of interest, and so we are both here doing this as volunteers because we are very married to school health and what it does for kids. So, first question, and what I wanted to start at the very beginning. Exactly what is a collaborative? And so, of course, I went to Webster's Dictionary, and this is what Webster's Dictionary told me. That this really is about realizing that no one entity, no one program is going to bring everything that kids need. And so we have to learn how to get outside of our comfort zones and bring in partners who can help us with the kids that we're trying to serve. It is made, a collaborative is not just the people in the school health center and their partners. If you do that, you're going to fall short of what you really want to have. It also includes people from the school building, paraprofessionals who are working in the school building, parents, students, and anybody who has an interest in that school. Many times, some of our best partners at a building level, and what I mean by that, a building level is at the school building level, happen to be the partners of the school. And they join forces with us, and there's a real synergy around what we're doing. So, this is where you get to do some work. How would you choose your partners for your collaborative? How would you go about thinking about who or what that is? And I will ask you to please step up to the mic if you have an idea. Marilyn's going to record this for us so we have it in front of us. Right up to the mic. Yes, absolutely.
Well, I have an idea, just an idea. I'm from the Department of Health in the District of Columbia, and we have been fortunate enough to have been given a considerable amount of money through the Affordable Care Act to implement FQHC. I'm an ex-FQHC person, school-based health clinics, centers throughout the city. We do not currently have a public health hospital. It was closed many years ago, so for those who don't know. So there are a variety of FQHCs, and now there are FQHCs who are adding school-based health clinics, and then there are independents. And DC is broken up in wards, and the school is going to actually fund the actual construction of the facilities, and we are going to help design the systems, the collaborative networks, and just sort of really be consultants with them around implementing these various programs. But our goal is not just to help one individual school, it's to create a system so that they can communicate, share data, da-da-da-da-da. DC, like many other cities with their wards, they all have their issues and their sort of ownership of particular things. So, for instance, 2 of the health centers are going to be within the school setting, and one's going to be around the corner because they have trust issues with the school, da-da-da. Okay. So what I had planned to do, I am the deputy director of 3 months, 2.5 months, in a city that I moved into recently. Okay. I have lots of experience, though, in public health at the executive level. So I do, and also at the actual clinical level, because I'm a PhD clinical psychologist working with children and adolescents. So I feel fortunate to have that sort of base of knowledge. And I've run FQHCs and worked in academic settings. So I think I'm bringing a nice little mixture of things. But DC is quite interesting place in terms of the relationships. That's all I need to say.
So you're going to bring your health partners and you're going to bring your academic partners. That's awesome.
Yes, that piece I'll bring, and I'll be bringing probably some funding to help with whatever it needs around systems. We're really interested in data collection and serving large populations of people. So our goal is that this is the beginning. So there are 5 now, but we're going to try to put them all over the city. But I'm viewing it as a pilot project.
Good.
You know, and in a pilot project, you know, you have certain goals, and my goal is, 1, is to get the 3 health centers built. And while they're being built, use the other 3 as pilots around developing some shared sense of partnership, and then defining what that partnership is for each side. In other words, who will do what, how data is collected, how it's funded, monitoring systems, evaluation systems, and all of that. And while they're being built and working with them, if we can be successful in that small pilot, then it will be easy to transfer that knowledge to the other 2. But the 3 that are already established are sort of entrenched. One of them is new, so they're not too entrenched, but sort of entrenched in how they do things and what they do. Because I am new, but I do have the resources to do some vetting and some and networking with people. I can be introduced to people, spend some time at the school, and I have staff too. Okay. So I guess. Did I answer your question?
Absolutely. Thank you very much.
I'll say, but my question is, my really big question is the working with these, how to start really the process of working with these 3 to get along.
And we will get to that, we promise. Absolutely. Other ideas about who you would collaborate and how you would go about deciding where you'd go to? Who would be your partners? Yes?
Hi, my name is Craig Hockenberry. I'm the principal of Wheeler School. That's actually our playground. Those are our parents. And Marilyn's one of our partners. But no, one of the first things when we choose partners is start with the community, find out what their needs are. Obviously, if we don't want to start a violin club and a piano club if nobody in the community wants to play the violin or the community. We don't want to build a swimming pool if nobody can swim and nobody ever wants to swim. So one of the first things that we did was started with all of our partners, our parents, our community members, volunteers, people that had a big stake in the community. You bring them together first and talk about what are the needs that the community feels that they want. And then obviously one of the other things is the staff. We have 126 staff members at Euler. So once we kind of find out what were the things that the community wanted, the staff put their input in. And then, of course, business partners, people that have a stake in the community, people that want to see the neighborhood get better, the community get better, and the school get better. And the 3 of them working together spit out some ideas about what's possible.
Thank you very much. You just hit some really important partners. Number one, foremost, in my opinion, is the community itself. Other people that you would go to think about who you might want to go after in terms of a partner. There's one group that I'm thinking about that's a real natural. I didn't hear what you said. So one of the first groups that I like to go to are the students themselves. A lot of them, and what we think might not necessarily be what they think. And so I think that if you can create that bond where you're using some of their ideas you now have a great resource that's going to tell you what the next resource needs to be. So it's all of these people, and it's generally driven by data. So data is very important. I would suggest that, yes, you can use state data. You can also use local data, school system data. They have a lot of data. And then if you have anything about the kids in that area, that's another very important resource that you have to think about if you're going to build a collaborative. Any others before we leave this? Okay, so in Baton Rouge, our collaborative. And Marilyn and I are going to be tag teaming this whole time because both of us, she came to Baton Rouge one day not long ago, and for a whole day we just talked to each other, and it was amazing how similar our two cities really are. So in the health center itself, our fully expanded model are physicians, of course, and they can either be pediatricians or family practice physicians. We have both of them. I will also tell you that the piece that I have quested after the longest was the child and adolescent psychiatrist, because from the inception in Baton Rouge, we had mental health staff in our health centers, and that started in 1987. But it's the layer of the support providers that can help those social workers really do the job that they need to do. Our child and adolescent psychiatrist also trains our nurse practitioners, who for the most part are family practice. We also have residents that come in, and residents are very important because they're physicians. They're just getting a subspecialty, either in family practice or pediatrics. We have, for now 4 years, had mobile dentists who are serving about half of our schools. And so I'm not so fond of a fixed location because in Baton Rouge, one of our largest challenges is transportation. These kids can't move around very much. We have mobile optometrists because we have a real vision problem. And it's the thing that I most am talking about today, because if you can't see, you're not going to be able to achieve in school. And I will encourage all of you to go look at your population and pay attention to kids who fail vision screening and make sure that they get to the resource. The other thing that you'll hear me talk about a little bit later is there's not a training facility, be it a technical school, a university, we happen to have 2, we have a community college, and we have schools of nursing and colleges of nursing that are not my partners, every one of them. And I'll talk a little bit about just how many people we're training every year and what they bring to our organization a little later. The other thing that I did, and I think that you all might want to know about this, every school system in the country has to have a school health advisory council at the level of the system. I volunteered to be the wellness coordinator for the school system. I am not an employee of the system. I am their partner. But I did that because I wanted to have this school health advisory council because it's made up of people from the community and from the school system. So I encourage you to go back and find your school health advisory council at the system level. They do exist, and if they don't, start one.
Thanks, Sue. So I want to talk just a little bit to you about what it is that has helped make it happen in Cincinnati. And that's why I put up some information on community learning centers. In the rest of the country, these are called community schools. In Ohio, a community school has been designated the name for a charter school, and so we couldn't use community school to describe what we wanted to do. And so the term that was developed in Cincinnati is a community learning center. And so when I say community learning center, you can think of that in terms of the community schools that you're familiar with. And it was a part of an entire vision of our community by our former governor, who was serving on our school board, by city council member David Crowley, was one of our other advocates, and people that came from the community, like the Health Foundation, who were identifying where needs were and that community schools might be where those needs could be met. We were able to have a levy passed to build new buildings or renovated buildings for every school in our school district. That was $1 billion levy. And so what's been happening is over the 10 years, I think now that the levy's been in place, we're down to the last 10 schools. The vision of the group at the outset was to build health services into every school, and I'll talk to you a little bit about how that has happened. The other part I wanted to focus on a little bit is this goal to improve academic performance. So the fact that we partnered from the beginning for the addition of school-based health centers to be about academic performance, I think is one of the secrets to our success, because already we had started speaking in the language of the school, not just health providers, because you know that when professions talk to each other, we don't often know the language, and we don't often understand very well what the needs of the other group is, which is why collaboratives are so wonderful. And then I wanted to just say that there were two collaboratives that formed. One was a mental health collaborative, and you'll hear me refer to Mind Peace. And the other health collaborative was developed and actually became officially named in 2006, and that's Growing Well Cincinnati, and that's one of the things that I'm doing. And the collaborative, what we did is establish guiding principles. I'm not going to read those to you. You can read those. And if you'll notice, well, I think the date is cut off on the bottom, but these were established in 2001. So we're basically now coming up on 11 years of having gone through this process, established what the school district wanted to do, and saw a group of health providers and other wellness providers step up and say, we want to partner with the district. The leader of that was the Health Foundation of Greater Cincinnati, and the school district will be indebted forever for all the things that have happened as a result of that partnership. The other thing I wanted to just mention, and you can see, is some of the partners that are included in this. So the discussion probably took 2 years. And what was different about this is the collaborative was forming at the district level. And that's what a community school model does, is that it creates and begins a discussion at the district level, hopefully, beyond just at the school level about it, so that you can begin to talk about data sets, tracking outcomes, looking where the need is, planning to meet the need. All the things that if you're just down at a one school level may fall a little bit short of being able to reach that goal. And you have to have enough long-term vision for that to happen. Like for us, someone said, because there's been a lot of really positive press, and the comment that was made is, okay, now after only 6 years of existence, Growing Well has become an overnight success. And that's really kind of the way we laugh about it and talk about it, is it does require so much investment and visionaries that hang in over the long haul. And it requires funders. It requires people willing to help change policy. So now we're going to talk about oral health. And if you were in the presentation yesterday, I'll sort of shorten some of what I did, because Kate Keller from the Health Foundation talked already a little bit about what we've been doing in Cincinnati. Sue, I'll let you take up.
So to kind of give you a little history of Baton Rouge, we were one of the original Robert Wood Johnson grants back in the 80s. So our oldest health center was actually opened in 1987. We have always been there, and we've always studied our data, our internal data. So in the year 2000, there was a funder from the Capital Area United Way, of which I am not one of their agencies. But what they wanted to do was to look at a study in their catchment area that looked at the biggest need for adolescents in the area. And so they came to me and to a rural parish who also had school health centers, and they said, we would like to study your comprehensive physical exams. We will sign the papers so that you have HIPAA compliance. But what we're looking for is we want to know what's the largest single finding of your comprehensive exams. So they looked at over 1,000 comprehensive exams in both East Baton Rouge Parish, done by health centers and schools, and also in St. Helena Parish, which is very rural, but is still part of the Baton Rouge region. Our largest single finding, when they got through with their data, was dental caries. That was in 2001. It took quite a number of years, but we have finally arrived. And so, this is oral health in the state of Louisiana. Just so you know this, I serve on the State Oral Health Coalition, and I was appointed to the fluoridation board by our governor. And I don't know a lot about dentistry. I'm not, by no means am I an expert in dentistry. But I know that the children need this service. What we found by studying state data, and by the way, Louisiana is one of the top states in terms of its implementation of the Children's Health Insurance Program and the sign-up rate for kids. So we have an excellent data source to go to say just how far are we reaching kids across the state of Louisiana. And what we know in the last year, even though they have insurance, it's actually 537,000 children in the state of Louisiana had no evidence of a single oral health visit in the last 12 months. That's pretty sad. So we also know that 19% of the kids aged 2 to 19, which most of those kids are in school, have decay. North Baton Rouge, which we divide this parish, we have parishes instead of counties. North Baton Rouge is a HIPSA, a health professional shortage area for dental services. And as I keep coming back to, in 1994, when I came to this job, the city leaders were talking in 1994 that transportation was a huge problem. I just left a meeting in Baton Rouge not very long ago, like last month. Guess what the biggest problem is? Transportation. So I'm done, and that's when I started thinking about how am I going to get outside this box and bring people to school, because I'm done. So, about 4 years ago, I was approached by a dentist, and I want to explain who this man is. His real work is with the other age group in our country that lack resources in oral health. Anybody have any idea who that might be? The elderly. His work, he does mobile dentistry in nursing homes. That is his work. So when all of this evidence started emerging about how the difficult time we were having getting oral health services in Baton Rouge, Greg Foss came to me and he said, I'd like to do mobile dentistry in a school. I think I can transfer what I know about nursing homes into a school building. I'm very cautious when I embrace people. And I said, okay, Greg, even though I know this is a huge problem for us, I'll do it if you do one thing for me. I said, I want you to bring a team to a designated school. I will get the consent forms for you. But for 3 Fridays in a row, we're going to come watch your team deliver dental services, comprehensive dental services to the students. I want to know that what you're doing is quality. Now, let's be honest. Truthfully, did I really know what that probably looked like? No. But I brought in some people with me, people from the school system, so they could be comfortable with it. And we went in and we just watched. And it was amazing. They were seeing kids about 20 to 24 a day. They were taking care of their problems. And all of a sudden, we had a fix to what was a huge problem. So he is now serving about 50 of our schools. And the reason let me also explain this to you all. We are not just school-based health centers. We have 11 school-based health centers in Baton Rouge that are run by health centers and schools. In 2004, the school system became our largest partner. And what I mean by that is they outsourced their school nurse program to us. And I also want to tell people in this room, it wasn't malicious. Here's why. And I would say that this is also going on in your schools, wherever you are. The superintendent of the school system came to me and he said, I don't know anything about medicine, yet I find myself with all these very medically fragile children, and we don't know what to do with them. Would you come help us? And that's how this all began. It wasn't malicious at all. It's because he knew that there was a problem, and he knew that he and his staff did not have the knowledge to really know how to deal with these kids. And so that's how this partnership was struck. We brought in all the school nurses who wanted to come over. We hired some more, and we've been doing this now for 8 years. The other thing that this school, the mobile dentistry, spawned in Louisiana was a bill by the Louisiana Dental Association trying to bar mobile dentistry in schools because it's not high quality. Well, we're going to agree to disagree, but I ended up at the legislature and at the Board of Dentistry testifying on behalf of this dentist who was doing this work. But what emerged out of that was a whole nother group of partners. What started off as 2 dental offices saying, you know what, we'll close our offices for half a day and we will see kids from schools that are close. They saw that first year about 80 students from 2 different schools. That has now gone to 12 dental offices who over the course of every Friday in February see somewhere between 800 and 1,000 kids in their dental offices. They're not doing comprehensive dental services, but what they are doing is they're checking to see what kind of problems the children have. They do oral health education, they do sealants, they do clean the teeth, and they do fluoride treatments. And I'm not turning that down. So here's how this works. Who at one time was, they were testifying against us at the legislature. They became our friends. The school system agreed to supply the transportation, still a good partner. The dentists closed their offices, which, by the way, this is about a $75,000 gift every Friday that the school system gets because the kids, they close their offices. They don't see any of their own patients. We provide the dental consents and we coordinate the process. So the schools also send their own staff to do crowd control, which is a good thing. What happens in this process, though, is they uncover students that even the mobile dentist can't see. Not even they in their offices can see. So I'm going to tell you a little success story, which I think is evidenced by what happened. Last year, I got a call from one of the dentists, and she said, I got to tell you, we have found a child, an elementary child in first grade, whose permanent tooth is coming in right under their nose. She said, this child's going to require orthodonture, and she's going to require oral surgery in all likelihood. And I said, okay, so how much is that going to cost? And she said somewhere between $4,000 and $6,000. And I said, well, I don't happen to have $4,000 or $6,000 laying around, so what can we do? So she said, let me make a few calls. So out of all of this has emerged an orthodontist, an oral surgeon, and one other kind of periodontist, I think it is. These three men have all given their services to this kid. Her tooth is now pulled down low, and she still in braces, but she is doing what they're doing for her, what needed to be done. And I would say that makes this worth it, for whatever reason. I'll also tell you that we do in every year, we celebrate partnerships. And we have what we call health heroes. Those people, including the mobile dentist, will be our health heroes in December. The board's already voted on it, and that's who we're going to honor. Marilyn? Yeah. Yes, you do. Sorry about that.
What you've done is absolutely wonderful, but, living in an urban area with lots of people and busy and making money, I don't know how successful I would be in terms of trying local dentists. Maybe some. I guess the question I'd ask is, what's the possibility or what's the billing options around recruiting dentists like that, but being able to pay them either through the child's insurance or whatever other billing, Medicaid or free care. So I think I need some guidance around that.
So the mobile dentist has a memorandum of understanding with the school system. Embedded in that memorandum of understanding is a couple of things. Number one, he will be allowed to bill Medicaid, but he must see all comers. He cannot cherry pick the kids. And we will coordinate his entry into the schools, and we do. So the system has worked quite well, and he is able to cover his cost in what he's doing. I think that there are people in every nook and cranny that have this philanthropic gift, and I think our job is to go find them. This dentist happens to be one of those people.
Great. So I hope what I'll talk about will help a little bit more in answering that question. Please continue to come up and ask questions, because we want this to be as interactive as possible and to direct where your thinking is and where your questions are. That's what these workshops are all about. In Cincinnati, as you'll notice, these two programs that grew up from totally different parts of the country and with different financial models really do a lot of the same things. Our sealant program, I think, is maybe the oldest sealant program in the U.S., and so it's been going for 25 years. The health department works on it, and Cincy Smiles, which is a nonprofit. Between the two groups, they go in the schools and offer sealants. But what we recognized, and very quickly, was that there was a tremendous amount of dental decay. And some of the people that are here today from Cincinnati can really talk about that. The nurse who served the first year we were in operation with our school-based health center at Oilers here, and I think she can tell you about all the dental problems that she saw. So she's around as a resource if you want to talk with Mary Beth O'Leary. But the need was just overwhelming. And so one of the things that this group of people that you see on the list did back then is got together and said, what can we do? And very much in the same way, some of the community dentists have been putting in their support one child at a time. Our deputy dental director told me recently that one pediatric dentist had paid for the anesthesiologist out of his pocket $1,500 and then gave the services for the child for free. That's the kind of investment that we're seeing that to me is just totally amazing. And the stories are unbelievable. But I want to share one thing that I told at a briefing last year. There's a private dentist, his name's Dr. Larry Teepee, and he's been going to Honduras for 9 years. He called our deputy dental director, who's sort of the community connection for everyone, saying, we've got a problem. And she goes, yeah, I know, we have a serious problem. And what he said to me when he called is, I've talked to Nancy Carter, and I've been going to Honduras for 9 years. And suddenly I realized I want the children in Cincinnati to have the kind of dental care that I give in Honduras. And to me, that is such an aha for someone who's in a private practice and going and doing mission work to suddenly recognize that children in this country aren't getting the dental services that they need, and that it's affecting them in terms of their academic performance and their behavioral. I'll tell you one more story. We had a second grader at our Oilers school that I hope Mr. Huggenberry will come back and talk a little bit about. But this young woman was getting a behavioral health workup. And they were having a lot of difficulty with her in the classroom, and they weren't quite sure what the diagnosis was. Well, it was time for the dental screening. They did a dental screening and identified that she had dental decay in every part of her mouth. So the Cincy Smiles dental van came. They took her, got the parent consent, took her over, and they worked on half of her mouth. They did as much work as they could. And Dr. Larry Hill, the director of Cincy Smiles, said to me, I'm not sure we'll ever see this child again, because it was so traumatic. She'd never been to a dentist. She had so many problems. 10 days later, the person who sort of coordinates the children coming through said, a young lady came up and said, I'm here to see the dentist. And she said, well, honey, I don't have your name on the list. And she said, I've got today's appointments already. And she said, well, I was here a couple weeks ago, and my mouth hurts so bad, and it doesn't hurt anymore. And I want you to help finish what you started. So we realized that pain was such a problem, and that it was causing behavioral issues. And literally, they were able to cancel her behavioral health referral because her classroom behavioral health issues went away. And that's what collaboration is about. That's what listening to your community is about. I wanted to show you this. The school nurses and the dental program went together and created a program to identify the worst cases of decay. Now, a lot of dental people look at this and they go, oh my gosh, I can't believe you're doing that. You're doing a screening just with a pen light. How horrible, you're missing so much. Guess what? Every year, most of these were being missed year after year after year, and the dental decay was getting worse. So this concept of a school nurse doing a pen light exam became the way we would at least know what kind of problem we had in the community. After we identified, and you see the number of dental referrals that were needed per screening, and we screened about a third of the kids in the district every year. And you see how the problem is continuing. But if you'll notice a couple of things. In the beginning, we were screening around 10,000. Now there's a screening that's up to 13,000. The dental referrals needed was 24 when we had 10,000. Now it's 2,300 and we have 13,000. So we do feel like we're making a dent in this. Mm-hmm. And the other thing that doesn't show up on this report is the severity of what we're seeing has changed dramatically. So we were seeing almost exclusively what are referred to as D1s and D2s, some decay to pretty advanced decay. And now I looked at a sheet from one of our very high poverty schools this year, and I would say maybe 80% of the screenings, maybe even 90%, were D0, 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 no decay. And what we saw is that there were very few of those D2s where that used to be sort of the main thing that we saw. So we're starting with sort of a renewal of that effort, and that's what Kate Keller talked about yesterday. And so I hope we can come back next year and tell you how we've taken it up to the next level. I will say this, that it takes a lot of community support. It takes a commitment based on your school district, and it takes problem solvers. And that's what this is about. The Junior League has decided we're going to get aggressively after this, and they're doing just that now. So we're off on the next level of what we're going to do in terms of solving the problem.
Marilyn created the great segue, because what I'm hearing now, we're not as we haven't been doing this as long as Cincinnati's been doing it, but I now have principals who'll come up to me and say, the kids just aren't coming in here with their mouth hurting anymore. And I just smile to myself and go, yeah, you're right, they're not, because they're being seen at school and they're taking care of the problem. They also know that the kids aren't missing as much school, which is a huge achievement for them. One of the other things that I think is really gratifying, and it's going to go to what Marilyn says, we keep doing Give Kids a Smile Day every year. We've been doing it for quite a while. Now the local dentists are saying, you know what? We don't see as much dental decay as we used to see. And I'm like, whoa, what a great affirmation of the mobile dentist, because he's really the one who's taking care of this. Teachers are very happy with us. They come up to me all the time and say, this is the best thing you've ever done. Well, I didn't do a thing except hook up a few people. But I will tell you that this is the kind of partnerships and collaborations you must go after and build. And you have to think about the win-win. This problem is big in Baton Rouge, and I think our school nurses will now start doing dental screenings now that I've heard about what Marilyn and them are doing, because I think that we are really going to have to get after this. I think we're getting to a lot of kids, but there's a lot more kids out there. East Baton Rouge Parish has 45,000 kids in it, and 80% of them live out at below the federal poverty level, so that's a huge amount of children. This is another piece that we've added, and it's just like what Marilyn's doing. And I would encourage all of you, if you go down this road, to be sure that you think about this. This past year, we created a procedure or protocol, if you will, for dental follow-ups. These are kids that were either seen by the mobile dentist and there's something that they can't do, so they refer to the community, or they're seen during Give Kids a Smile Day, and their mouth has either some or a lot of decay. So the school nurses and school-based health center RNs, they all have to follow the same protocol, but it's to follow those kids to make sure that they complete the referral. Never think that just because you've called home and said to a parent that this child needs to go to a dentist, that the child really gets there. So we follow these children until we close the referral process.
Okay, so instead of me talking a little bit about the model and the win-wins, I want to do something a little different. I'd like to invite our principal from Euler Community Learning Center, Mr. Craig Hockenberry, to come up and talk to you about the academic impact that having healthcare at his school has made, because he does such a great job of telling the story. Craig?
I had no idea I was going to do this.
That is true. I didn't give him any warning.
Didn't. But thanks for asking. This is something I'm very passionate about. My name is Craig Hockenberry. I'm the principal of Euler School. We're a pre-K to 12 school located in Cincinnati Public Schools. So we serve everyone from 3-year-olds, well, actually, next year, infants, all the way to 12-year-olds in one building. So we have about 800 kids.
12th graders.
What's that?
Not 12-year-olds.
12th graders. Yeah, we have it all there. 800 plus kids. And I started there 14 years ago. When I first started there, Euler School was in academic emergency. I'm not sure how each state rates, but in Cincinnati or in Ohio, it's the worst is academic emergency, then academic watch, then continuous improvement, effective, and then excellent with distinctions. And we were in academic emergency for about 8 years, my first 8 years as principal there. So every year, my boss was trying everything she could to not have to non-renew me, because the community liked me, the kids liked me, and the parents liked me, but we just couldn't get any results. So we took a real hard look at why. What were the reasons that we were not getting any results in our school? And it was amazing when we took our time, and I came out of high school or out of college ready to get in the classroom, work with kids, work with teachers to be better, to get better at teaching practices and implement some of the best practices. But my whole day was about taking care of the medical, dental, all the social needs, all the non-academic needs of the kids. And I was awful at it. I would spend my days when girls had head lice that were, their scalps were completely moving. Obviously, they couldn't learn. Me and another social worker would roll our sleeves up and start, washing their hair. We had kids that had allergies that we didn't even know anything about. This one kid came into our office, and he was like giving the universal choke symbol. So I went up behind him and started doing the Heimlich, which I didn't even know how to do. And my secretary said, no, he's got a food allergy. I got his EpiPen. And she comes running after him, stabs him with the EpiPen upside down, and it goes up her thumb and goes through her thumb.
Oh, no.
So I got my secretary down, I got a kid dying, and now I'm like, oh, crap. And so I called 911, and they came. Luckily, he saved his life. But those stories were all over the place. I'm a panicker, so I'm like the worst person to deal with any kids that are sick. We had a kid that had mumps and measles, and I was like, what's that? And the secretary said, or the nurse said, who was there one day a week at the time, well, it's a disease that's been eradicated for like 55 years. And I'm like running down the hall screaming, everybody get out of the building. So I spent all of my time doing all the stuff I didn't know how to do, giving shots. Used to give medicine out, would give, like these kids would have medicine prescribed from the local clinic. And I would give medicine out when the nurse and the secretary were both out, and I'd be giving the wrong medicines out and everything. Just a mess. But that was what all my time was doing, along with all the other non-academic things. And the harder I worked, the worse our scores got. So the collaboration piece was pretty simple for me. When they brought the health department, Growing Well Cincinnati, the health foundation, and sat down with us and said, what can we do? We had a long list of all the things. And once those things started to get addressed, and it wasn't easy at first because we had to give up a space. We had to find a space. Then we had to find a way to get the kids to be seen where they weren't being seen during instructional time. So it does us no good to take kids out for 2 hours a day or an hour a day to get their teeth fixed if they're missing math and reading, because then they're just falling further behind. So we had to have someone coordinate that. We had to have someone coordinate the spaces, how we were going to cover everything, how we were going to blend the different organizations, the rules, because our rules inside our school were different than the rules at the health department. They had rules that they had to follow, so we had to come to like a happy place, and we did. Now, Euler, that you saw there in the earlier slide, will be moving into a brand new $21 million facility, and the health department, the school-based health center, has about a half of a city block of our building, and it's all dedicated to serving the kids' needs. So there'll be no more me running through the hallways screaming to run for your lives or anything. And then across the hallway, we have a vision clinic now. There was just a session upstairs that was just great to see it all come together. When kids fail their eye exams now, they go straight to the vision clinic. We have an early learning center. We have all these things that have come together, and we've collaborated based on what the community needs and what the data said. And the result was this. The less time I had to spend panicking over health issues, the more time I was able to spend inside the classrooms. And when teachers were making big errors, I was able to sit down with them and talk to them and coach them like a coach would. Hey, you're not hitting the ball right, or hey, you got to run, you got to do this, try teaching it this way, or spending time actually in the classroom working with the kids and them seeing me all the time and holding them accountable for what was supposed to be instructed. We slowly went into academic watch, which was a big jump for us. So we went from the very bottom of academic emergency, then we went to academic watch. And then the next year, we started to go up even more. We got to the very end of academic watch. We were one kid away from the next category. And then last year, we went into continuous improvement, which is the third category up. And we're the highest achieving of the 16 urban schools in our district. And this year, we just got our scores back, and we hit like 13 indicators. We're clearly on our way to being an effective school in Cincinnati Public Schools, and we're real proud of that. And all along the way, the organizations, the collaborations that we've had are the one thing that we can kind of link our academic success to. So that's pretty much it in a nutshell. So.
I just thought I could talk to you all day, but when a principal can come and tell you those kind of stories, that's when you learn just being in the building is not enough. If you're not out there, if you're not willing to, I mean, literally, I will say this one thing. When they came to us and said, a mandate just came down from the district office, and no child can be removed from class during core academic times. And my first thing was, oh boy, well, I guess health centers are out. And then we stopped and started looking at how to do it. AmeriCorps members are a part of the team that we have. So our nurse practitioner, Dilruba Rahman, who's here today, started working with the AmeriCorps members. And so we were, as Craig said, able to dodge these core academic times for kids. And we're able to get, I think this year we probably saw around 2,400 visits this school year for a school of 800. So we think it's a great model. And Sue's going to start and talk a little bit about mental health now. Yeah, go ahead.
Did you explain how you did that? You said, I'm sorry, what about the students when they said they couldn't come out?
Well, what we have, there's an electronic database that has the schedule. So for all the acute care visits, an asthma attack, you know, the things that need to be seen right away, we see those children immediately. But there are all the asthma rechecks, there's the ear rechecks, there's all the things that you can schedule. And so the school district gave us access to the students' schedule. Then these AmeriCorps members, and if you don't know about that, that's another whole discussion, but we found that they're a really key part of what we're doing. Their job was to find the student who needed to be seen at a non-core time, at a time when Dilruba had a slot available to see. Raise your hand so you can see who you are. And so we did it. The very first few months, our numbers fell a little bit, but as you heard me say, our numbers have been great since then. So it's about partnership and collaboration.
And I'll also mention in Baton Rouge, we have something called the reading block, which is a mandatory, all elementary schools, 2 hours in the morning from 8:30 to 10:30, kids are in reading block. They will not let the children out of reading block unless there's an acute problem. And so we've had to work around the same kinds of issues and challenges. But I can tell you that the principals do not want to see us leave, and so they are willing to work with us. So there are many ways to conquer this elephant. You just have to chew it one bite at a time. So I've been real fortunate mental health-wise to have mental health in our health centers from the very inception. It was the wisdom of an adolescent medicine physician in Baton Rouge who said, we have to put mental health in. We cannot do this just with medicine alone. And our large experience tells us that what walks in the door as a medical problem a lot of times turns into a mental health problem. And so you need to know that. You need to really think this part through. We all know there's a huge void. How do we figure out how to do this? This is a lot harder. So we started since 1987. FQHCs, Federally Qualified Health Centers, have a great model because they get cost-based reimbursement. And so in Jefferson Parish and in some other parishes, we do have collaborations going on around mental health. They don't know a thing about schools, though. That's the part, that's their huge learning curve, is how do schools work? In Baton Rouge, we have different kinds of models. We have taken all of our mental health therapy, kids who complete mental health therapy with our providers, and look at them for academic achievement. And what we know is 30% of them do better academically. Another 40% of them don't get any worse. We haven't seen the improvement that we wanted to see, but we do know we're on that trajectory. And then there's about 30% who actually stay the same and don't get better. But that's a pretty good recommendation for mental health therapy. If 70% of the time the kids are at least holding their own, and 30% of them are getting better academically. We have Capital Area Human Services District, which is a quasi-state agency, and it does also place social workers in schools, but they will only take children who have a full-blown access diagnosis, because they have the capability of billing for the services and have to make up the salary. And so that's who they're limited to, those kids. We have an adult psychiatry program that is beginning this year. It starts in July, a few days away. In year one, these residents will not do anything outside of the hospital setting. Oh, but in year two, I didn't know this. Adult psychiatrists have to spend a pretty good portion of their time in adolescent psychiatry. Guess who gets to be their training sites? It's us. And so that's, I'm like, you're kidding me. Y'all are going to send all of these residents to us, and we're going to have them for how many months? I was very excited. Yeah, pardon me.
Come up to the,
Sure.
yeah.
I think that's great, but I'm a PhD clinical psychologist by training, and psychologists are better trained than psychiatrists for therapy, particularly with children, and I think that's a great model, but I would just like to encourage you to bring in psychologists, because what will happen is you'll find all your kids on meds.
Right.
It's the truth.
So I agree with you wholeheartedly. In fact, my medical director, who is a board-certified adolescent medicine specialist and a pediatrician, the optometrist, the dentist, and the child and adolescent psychiatrist, we all met not too many weeks ago, like about 2 or 3 weeks ago. And the final question I asked them was, who's not at the table? And the child and adolescent psychiatrist said, we got to have some psychologists. So that's the next piece I have to go conquer. And it's not like I haven't asked, but I have to just keep going back and asking some more.
And let me say one thing about it to further address your question and concern, is that the model, and you'll see our model is similar, really put mental health counselors in place for us in most of our schools now over the last 5 years. But the piece that's the hardest to get is, for those children who need medication, the regular refills on the medication, not to mention the ones who are new and unstable. But I can't tell you how many times I get a call saying the parents haven't come back, the psychiatrist won't see them again, they aren't going to get their meds again. So what I find happens is kids that have a really serious problem, they get identified by the psychologist. They go through, develop the process, realize they probably need medication in addition, start them on medication, and then they can't get the refills because they can't get them back because the parents haven't done what they need to do to get the child seen again. And so what happens is, now the time frame has been too far, and the psychiatrist says, I'm not going to refill the medicine. Sure.
Probably is that the parents haven't really accepted the diagnosis or the use of medication on their children. And that's the problem with the psychiatrists. They say this is what they need, they give you the script. But if the parent hasn't bought in, they're not using it. So the important thing is, whether it's a psychologist or a social worker, is to spend some time with the parents accepting that diagnosis and the use of that medication.
Yeah, I agree. And that's what, and I'm going to talk a little bit about how we've worked on this piece. So the lead partnership concept developed in our district in 2006. That is for Growing Well, MindPeace is our partner. So MindPeace manages improving health services that are related to mental health, and we handle the other pieces. So this is some of the things I already said. And there's a lot of work to refer on site. There's a lot of opportunity for teachers to refer. The parents are then brought in to get the consent process and to engage the parents. And there are monthly meetings of mental health at every school that has a provider. Psychiatrists, the goal is to have them there once a month, or they go back to the site where they are. And like I said, I will tell you that's a problem. That's why I think, as a pediatrician, I think that telemetry is going to help us solve that problem, because I have been very frustrated with having to literally call the police to have them pick up a child that's totally unmanageable. It's Friday afternoon, it's 4:30, and the school nurse is trying to manage this unmanageable child, and they end up in the ER simply because they didn't get their meds refilled. And so it is a big problem. And then also we are working on and have been developing a model for ADHD treatment where the pediatricians are going to come on site to our schools and do this, not just the ones that work with a school-based health center, but some community pediatricians are going to begin to come in and help us manage ADHD. And it's a wonderful program. The people at Children's Hospital in Cincinnati have received multiple $1 million for doing the research on how to improve ADHD treatment. And so some of that NIMH dollars is going to be, I think, really beneficial to us.
So here's some of the win-wins in both cities. We're going to talk about it. So we have partnerships that are continuing to form. There's not a day that goes by that I don't get an email or a phone call from somebody who says, can I come sit down and talk to you? And it's somebody who has an idea about some part of adolescent health, and they want to know, who do I go to? Who are my most likely partners? And so a lot of times it's us and others. And so I think that what's happened is, I've been around for so long, they come to me and just start making linkages. But I'm glad to be that person to hook people up, because if they're going to come work with the kids, that's the whole point. So we have been known as the partner for lots of people. I've already mentioned this. This is 11-12 data. This is like hot off the presses. Now do keep in mind that we have 90 sites, because we are the school nurse program also. We train 2,300 health professionals. Those are physicians, nurse practitioners, social workers, mostly registered nurses, but we also train LPNs and we train medical assistants. And those students spent with our staff about 17,000 hours, which is 11 FTEs. We do 3 massive projects every year. The first one is vision and hearing screening, and they are instrumental in helping us screen 25,000 children between September and December. The other thing we do right in the middle of that, because it's the time we have to do it, is we do the flu project, and we immunize between 8,000 and 10,000 children on school campuses in about a 4-week period. And then the final one, and the one that I'm most excited about, is in the spring of the year. Those 2 massive projects pretty much dominate the fall. But in the spring semester, we're going to start working on some of the larger problems. They will then design health education material and presentations that they will go into schools and start raising the awareness of students and teachers. And from this, we hope will come a groundswell of people to really look at one of our biggest problems. Baton Rouge, unfortunately, has the distinction of being one of the most violent cities in the United States. So we're going to take violence head on as a public health problem and see what we can do with it.
So this is where we want to brag a little bit, in that we've seen, not only at Euler School, but our entire district has seen with this community learning center model this kind of impact, that the district is now in effective rating. We are the highest achieving urban district in Ohio, and they were in academic emergency also. That our graduation rate has changed dramatically. And I will say that Craig's work at Euler has really made a big dent in this, because almost none of those children were making it to a 10th grade seat. And he's turned that around, he and everyone that's been working with him. So we're excited about what we're seeing happening academically. And we're seeing more partners. And I want to just, I'll try to close because I know we're about out of time, to say this, that the Health Foundation I mentioned earlier was at the beginning of this. They put in the first school-based health centers. There were 4 that were there from 99 to, I guess, 2008. And then we started to grow based on the investments everyone had made in the community. This year, we started the school year with 10 school-based health centers. And those 10 school-based health centers were all started based on planning grant and implementation grant dollars from the Health Foundation. They've invested, I think it's $4.5 million on school-based health care in the greater Cincinnati area. So it's wonderful when you can go out in the community and find that kind of hero to help you with what you're doing. And not only do they put dollars in, they put time in. 2 of the funders are here with us today, and Kate Keller received recognition today from the National Assembly for the great work she's done. So our vision is this time next year that we'll come back and we'll talk about our 20 school-based health centers. We will see an addition of a new partner, Mercy Health Partners, where they're going through a planning process, so we're trying to help encourage them to that positive decision to start. So that'll be our first hospital-associated school-based health center, and they're going to start out with 3, which is awesome. One of our community health centers, our FQHCs, is going to open 2 sites, and the health department is going to open sites at 5 additional schools. So we really think that we're on a roll, and we think that it makes good sense.
Can you talk about that bullet that said the crisis in funding for school nurses limits to learning?
Let me let Sue finish, and if we have time left,
I think I have another.
is that okay?
Yeah, go ahead. I think you're fine. Go ahead.
Okay. Last year at Christmas, we got a present from our city council. We had 39 school nurses. They proposed their budget. The city manager had proposed a modest decrease in the $2 million a year they were giving to fund the school nursing program. They zeroed the budget. And so what began was, it could have been a let's throw up our hands and go home, but we have an amazing community in Cincinnati, and not every member of city council felt the way that that proposal went. So we started a community advocacy, and what happened is, and I've got great, if you want to go to the Facebook page, I've got some great testimony from people like Dr. TP. We had people who went to the budget hearings and said, you can't get rid of school nurses. The budget was in crisis. They went on ahead and voted to zero it out, but then a proposal came, and the Health Foundation stepped up again with money and said, city, if you'll put some dollars back, we'll put some dollars with it. And so they leveraged money back into the city's budget for us. So we ended up the year having a proposal for $650,000 for this calendar year. So literally, with the great advocacy, we were able to save a good piece of the program. We went from 39 school nurses to 26. And when we started to talk about the solution, and that's what this slide is about, that's when the Health Foundation formed a planning committee. That's how we got Mercy Health Partners to come to the table. That's how we got the Greater Cincinnati Foundation to come to the table. That's how we got our Deaconess Hospital Foundation to come to the table, and they just committed $375,000 to open the Western Hills Dater High School School-Based Health Center. So we took crisis and turned it into opportunity. But I will tell you that we reeled for an entire year because, just like Sue, the school nursing program is a part of what I believe in and have been committed to and have been working with. And it was extremely traumatic to see that much loss of services.
Hey, Marilyn, I'd just like to know that all of the city council members.
Come up to the
mic, please, Kate.
All of the city council members that were voting to zero out those nurses, none of them were reelected.
I'm Francie Wogan from the Health Foundation as well, and if you're not involved with working with other funders and they're not used to contributing to help fund school-based health centers, sometimes it's very helpful for them to talk to other people who are, so that you can feel free to give them our names and we'll be glad to talk with them. We do a lot of consultation among our peers, both Kate and myself.
I don't think any of us could have done what we've done without community foundations. We have 3 in Baton Rouge. Our largest one is the Baton Rouge Area Foundation. And since 1994 forward, they have committed a little over $1 million to health centers and schools for various and sundry projects that have really taken us to where we are. We have a Pennington Family Foundation, and they have done probably about $300,000, and the Wilson Foundation about $100,000. So I think that you really need to go and look at your who is in your community, who are likely candidates, and then go sit down and talk to them about what their priorities are and see how you can line up their priorities with what you are interested in doing. Any other questions?
Well, we hope this was helpful. We have our cards, so you can email us if you have questions. Both Kate and Francie from the Health Foundation have offered up to share their emails with you. And we just really wish you the kind of growth and success in improving the health of children that we feel like we're in the middle of. And we agree to help you in any way we can, because we want not just the children in our communities, but the children in every community in the United States to be healthy, and we know they'll learn better. Yeah. Thanks.
Thank y'all.